Hello and welcome to this tutorial on introducing the Patient Experience Mapping Toolbox. My name is Elisabeth Oehrlein and I serve as Assistant Vice President of Research and Programs at the National Health Council and have been leading this project for a couple of years now. I want to acknowledge others who have been contributing. First of all, I want to acknowledge our supporters without whom we would not have been able to do this project. So thank you. I'd also like to give a big thank you to our advisory board members whose names are listed on this slide. They've been very important for developing this toolbox, and we really value all of the expertise that they've brought. I also want to thank and acknowledge all of the individuals living with chronic disease who contributed their time and expertise as folks who participated in cognitive interviews and pilot interviews as we've been developing these resources. And I also want to acknowledge the rest of the project team, especially Silke Schach, who's been very involved in this project since the very beginning. So thank you. So now to frame the topic, I'd like to start with the FDA's definition of patient experience data. So patient experience data are intended to provide information about patients' experiences with a disease or condition. It can be collected by any persons, including researchers. And we're really trying with the patient experience data to capture information about the impact, including both physical and psychosocial impacts of a disease or condition or related therapy, and also patient preferences with respect to treatment of the disease or condition. So it's a pretty broad definition. And of course, there are many different methods that one can use to capture patient experience data. You might use a survey, you might do in-depth interviews, you might even look at existing real-world data. But the resource that I'm going to be explaining and introducing today, the Patient Experience Mapping Toolbox, this is one set of resources. It's one type of method that can be used by researchers to engage and document patients' experiences before getting a diagnosis, while getting a diagnosis, and living with a diagnosis. So let me go and show you now, just as an overview of the Patient Experience Mapping Toolbox, what is included. So we've got both project planning and data collection tools, this introductory video, but then we also have some resources for the project team, including the coordinator guide, the interviewer training guide, and then data collection tools, including a plain language consent form, interview guide template, as well as the Map My Experience visual. So I'm going to be introducing each of these resources individually. So let's jump right in. But I want to tell you a little bit about where we are and where we've been, how the toolbox was developed. We started the project in 2019, and at that time we formed an advisory board. You already saw the names of the individuals who have been contributing as members of the ad board since then, and we met with them very regularly over the course of the last 2 years. We conducted a lit review where we looked at what's already out there in terms of published patient experience maps, also conceptual models and related resources. And the purpose of that was to identify what kinds of concepts are others doing in their patient experience mapping work. And then to also, delve into conversations with the ad board about what's missing from the, especially, National Health Council, we represent, so the chronic disease patient community, what's missing from existing approaches and how can we fill some of those gaps? I do want to acknowledge that we looked at what's in the public domain. So, there's also, of course, proprietary resources that we didn't have access to, but we're excited about, what we learned and really leveraged a lot of what we found through the lit review. We agreed upon what would be included in the toolbox. Then we got Irb approval. We developed a draft version of the tools based off of existing work that we'd previously completed, as well as what we found in the lit review. And then also lots of conversations about how all these different pieces fit together. Once we have a draft set of tools together, we went externally and had all of the resources that are going to be patient-facing. So that includes the consent form template, it includes the interview guide, it includes the visual that I'll be showing in a couple of minutes. And we wanted to make sure that those were understandable broadly. And so, you know, are they in as plain language as we can get them to be? Are we thinking about design elements? You know, want to make sure that there's blank space and that it's easy for folks to understand where they're supposed to be looking within the visual, and so on and so forth. And so that was really beneficial to us as part of the process. We conducted cognitive interviews, and the purpose of those interviews was to ensure that the folks who are the intended audience, which is you know, so far, people living in the US who have been diagnosed with a chronic condition, in many cases, multiple chronic conditions, that they were, you know, understanding what we intended for them to see when they were looking at the visual, and that they, you know, we could get their feedback and make refinements. And so that was, that's what we did as part of those. Then we pilot tested out the tools with 30 individuals diagnosed with a chronic condition. And, you know, in that particular phase, what we're trying to find out is, can this be used broadly across chronic diseases? Are there, you know, specific questions that we needed to add as we were going through the process that would be applicable to certain diseases, and that we wanted to include as potential questions? And so those were extremely useful as we were refining the tools. And so then we did additional refinement based off of the interviews. And now we're at the point where we're releasing you know, version 1 of the toolbox. And I will show you a tour of that in a moment. And in terms of the next phase, what we're interested in doing is disease-specific pilot testing. So we're certainly aware that, you know, there are refinements that will still need to happen as folks are using these tools, that there will be things that emerge that we still need to address. Maybe there are disease-specific questions that are not currently included that need to be included in, you know, future iterations of it. And so we really welcome your feedback as you are using the tools, and actually request your feedback on how things are going if there's additions that you would suggest to us. So here you can see the project planning tools. So we've got the coordinator guide, we've got the interviewer training guide, and then we also have a link to the compensation toolbox. So if you're accessing this video from YouTube, take a look at this link and go ahead and access this website directly. Then we also have the data collection tools, which include the consent sheet template, interview guide template, and then the Map My Experience visual. So we will be going through each of those resources individually. I did just want to clarify, you know, before we jump in, some of the context about how these are intended to be used in tandem with one another. So I'll be showing the visual. A piece of the visual is depicted here on the left-hand side of the screen, and then a component of the interview guide is depicted here on the right-hand screen. And so how we've developed them, they're aligned with one another in terms of structure. And then the questions, of course, would be interviewer facer. And so for the research team who's using this, you can see that we've got bolded questions and then we've got unbolded questions. And the bolded questions are those that we think are appropriate to include in any patient experience mapping exercise. And then the other questions that are unbolded are probes. And so they may or may not be relevant to your population. They may or may not be relevant to your specific study objective, so on and so forth. So that's kind of the structure of how we have set up the interview guide and the visual. So here I'm just listing my email address because I do want to make a note that if you've got any questions that I don't address during this next phase of the tutorial, or if you're interested in learning more or partnering with us, perhaps you're interested in doing an international adaptation or something like that, let us know, because we'd really love to be involved and hear more about what you're doing. So now I'm going to share the website directly and walk you through the components of it. So here's the website, and it's available from here on resources. You can find the patient experience mapping toolbox as well as the direct link. So we have a little bit of information about it up at the top, and then a link to this video that we're recording. Then here are the project planning guides. So I'd like to just walk you through and introduce you to those. So here you can see this is really intended for the project team. And we're expecting that the toolbox will be used by a variety of different stakeholders, and that they will have different levels of experience with conducting patient experience mapping exercises. So, for consultants or researchers who are doing this every day and maybe just want to try out our approach as a standardized way, this may not be relevant for you. But for folks who might be in patient organizations, perhaps you're a student working on your dissertation, this might be helpful for you in terms of getting started. We outline information about, questions, forming research questions, aims, and really some of this is intended to help you developing your protocol that you'll need to get submitted to an institutional review board, because this will be considered human subjects research, although it's not interventional. And then we've also got information that's based off of our own experiences, pilot testing it, about developing your interview guide, using the template that we provide, considerations like recall period, also the interview mode. We tested these during the pandemic, and so we've done everything virtual, and it's worked very well for us, having the Zoom sharing the visual and then using the interview guide. But you do need to keep into consideration how that works with the particular patient population that you'll be interviewing. And then we've also got some tips for you in terms of prepping participants and then disseminating findings. And so, it's really a guide, and I encourage you, if you're going to be using the resource, to take a look in more detail at that document. Then we have an interviewer training guide. And so the prior document is really intended for the project team. And now this is a document that's intended to be shared with the individual or individuals who are conducting interviews on your behalf. And it walks them through all of these different phases, including, how do I use the interview guide? How can I use the probes throughout the interview, and then some special notes that we thought might be helpful for folks as they're preparing. We do also really recommend that the individuals who are going to be conducting interviews do a couple of mock interviews beforehand to get themselves comfortable. So those could be with a friend or somebody else from the project team, but we find that's really helpful and is kind of a best practice. There is introduction to the visual and then some general interviewing tips. And these, I think, are quite helpful also in terms of thinking through, questions you might want to be very clear with the interviewer, or the interviewer wants to make sure that they've got clarity on before they're conducting the interviews. Also, here we link to the NHC's patient compensation toolbox, and this was not developed as part of the patient experience mapping toolbox, but it includes a fair market value calculator that's specifically for patient engagement. And so, you know, we do certainly encourage and expect that folks who are applying the toolbox will be compensating the individuals who are being interviewed. And so the calculator was developed, you know, over the course of a couple of years with lots of opportunities for patient engagement, finding out, you know, kind of what's best practices when it comes to compensating folks from the patient community. So this can be helpful for you in terms of budgeting and thinking about how much to compensate the individuals for their time. And now kind of the bulk of the resources. So first of all, we've got this consent sheet template. We developed this specifically for patient experience mapping. You might find that it's helpful for other reasons as well. So let me click on here and it'll open a Word document. So let me now just reshare my screen so that I can show you the consent document. So here you can see it's a Word document that pops up and you can edit it, make sure to you know, include your own information. You can change out the logo as well to be your organization so that anybody who's participating in your study immediately knows, you know, who am I working with, who's interviewing me. One thing that I wanted to call out that came through as part of the health literacy review was the importance of referring to this kind of a study as an interview, especially in a consent sheet, and especially when, you know, speaking with individuals who are contributing to your study, because there can sometimes be confusion if you say the purpose of this study, for example, that people might think, oh, is this just part of is this actually a clinical trial, or is there an intervention that I'm also going to be exposed to, or something like that? And so, you know, for researchers, it might come naturally to refer to this as a study, but be careful when you're talking about the study to participants that you're just referring to an interview, because it's a lot clearer. And so you can see there's a second page here and includes information about everything. And we've used this as part of our own project and have submitted this to our institutional review board. And so we do find, we have found that it's, you know, been successful, that it's been accepted as well. So now let me figure out how to go back to the website. Okay, so now I'm going to walk you through the interview guide template. And so, you know, here's something to keep in mind is we've got two different versions of it. So the first version is going to be a preview version that you can just open, and I'll do so in a moment. And then the second version is one that's an editable Word version. And so you'll need to go through a survey before you can download that, but they're both free, you know, publicly available for anybody to use. But we do want to make sure that everybody's agreeing to our terms of service. And we also want to make sure that you're referencing our work so that others can find out about it as well. And we'd like to hear from you about how it's going. So I'll show that in a moment, but there is also a copy of the Toolbox Terms of Use down there. So if we click on this, you'll be able to see the preview version, which I'll just show for a moment because I'm going to open up the Word version so that we don't have to look at this big text here. But you can see that it's got all the same information as the Word version is going to have. So it'll be helpful for you in terms of planning. If you want to just take a quick look at it without filling in the little survey, but you can access this version here. So let me go back to the main page so that I can show you instead the Word version. So here again, just go ahead and click on this, and it's going to bring you to this little tiny survey. And again, this is just for tracking purposes. And I'll just put my name in here and National Health Council. And so we, again, just really want to make sure that any improvements that you think that we should be making to it, that we're systematically capturing those, and then also that we are understanding how it's being used. So again, you'll just need to look at those terms of service and agree to them. You'll agree that you'll reference the patient experience mapping toolbox in all presentations and publications. And we have a suggested reference on the main page, so agree to that. And then also that you'll provide feedback on the tools within 90 days of study completion. And then we welcome you to sign up for our mailing list so that you can receive updates about the toolbox as well as anything else that we're working on. Okay, so now assuming that you've accepted everything, what will happen is that another Word document is going to pop up. And so this will look the same as the document that you just saw, the PDF version, but you can see the first page is some notes to researchers about what this is and how do you use it, and then some information about the fonts and things like that. Here, I'll just call to your attention that we've got lots of different topics that are being covered here. It's a very long list, and just keep in mind as you're looking through here that the purpose of the interview guide is in order to provide a template, but we certainly don't expect that you're going to sit with the participants for 4 hours going through each of these questions, because the purpose of providing this as a Word document is so that you can modify it based on your specific study objective. And then the only other thing I'll call attention to is that, there's all these different domains that we cover as part of sample questions. So we hope that those are really helpful for a broad variety of study objectives. So here you can see the interview guide, and this is some suggested language. We've used it and thought that it worked well, and some places where you'll need to fill in your own information. Privacy disclosures. I do want to clarify that we recommend sharing that consent sheet template in advance of the interview via email so that folks have access to that and have a chance to actually read through that. We have prompts about consent, and then to start recording, double check things. And then you can see here, this is the upfront information about to learn some characteristics about the individual that you can carry forward throughout the study or the interview, and so that the interviewer can probe, for example, how did maybe access to transportation impact their experience at certain phases. And so, take a look at these and figure out what makes the most sense based off of your population and based off of your study objective. And then capture any other demographic information. Then we have information here about how to introduce the tool and some indicators to the interviewer of where they might be pointing, because recall that we're using this in tandem with the visual. And, so just go through and introduce them. And then the first questions will be about experiences before getting a diagnosis. And we have two different paths, and I'll walk you through that also on the next, on the visual, but there's essentially two starting points. There's one where it's I or someone close to me noticed something was different, or I didn't feel right, or an alternative is that a healthcare provider found a problem. And so, based on a lot of conversations and based off of the cognitive interviews in particular, this is where we landed in terms of the starting points, because we want to use these broadly across different populations so that we've got some consistency in data capture. And these were the two kind of most common ways that individuals found out about a chronic disease or a disability. And, we do have some special questions also in case of people being diagnosed before or at birth. So, they won't recall that. And so the interview guide gets a little bit swapped out and reorganized depending on if that's going to be common for your chronic disease. And so you can see these prompts here. I'm not going to go through each of these sections. You're certainly welcome to reach out to me if you've got any questions about any of them. But you'll see common throughout the entire interview guide that we've got those bolded questions, and then we've got some follow-up probes. And so, certainly let us know if you have any feedback about them, how we've bolded them or unbolded them, or additional questions that you find helpful. We're definitely open to adding them. And then the only thing that I now will go to is see there's sort of common questions about if they already said that they had symptoms, then you can carry that through and ask about it. And then we've also got recurring questions throughout the interview about emotional health, life factors, which is how we refer to social determinants of health and some other aspects. So let me now close this, and I'm going to go and introduce you now just in full to the Map My Experience visual. Oops. Okay, so we're back on the main site, and now Map My Experience visual. So again, because this is really a part of the study, we're going to make you accept the terms of service one more time. And so do read through those. And then I'm going to do download. And so this visual is a little bit different than how you might be thinking about a traditional patient experience map. Patient experience maps oftentimes will depict a disease-specific patient experience, and it'll be a visual of that. But this is instead a map that is intended to guide and help you out during the interviews, and help the individual who's being interviewed, have something to look at, and also to have some visual cues throughout. So you can see that it's organized into the 3 different islands, and these are the same way that the interview guide is also formatted. So everything's aligned with each other. So we've got life before getting a diagnosis over here, getting a diagnosis, and then living with a diagnosis. And then we've got those 2 starting points that I mentioned. And so depending, how their experience started, you'll be capturing either here. And that has, implications for the interviewer in terms of where they go in the guide. But for the participant, it's just, a matter of taking a look at this. And then a healthcare provider found a problem, and then, you'll end up over here. And so, don't want to go through each and every one of these, but really wanted to just emphasize that we wanted to be very sure that what we're putting up in front of the individuals is clearly acknowledging the winding roads and the challenges and oftentimes lengthy experiences that people go through getting a diagnosis, and also before getting a diagnosis, and then living with a diagnosis, because as researchers, we really want to know about the also not so good experiences and any barriers, as well as, how any of these things impacted their experiences. So that brings us up to the life factors as well. So as you'll have seen in the interview guide, there's, probes throughout that get back to the life factors. But, we're interested throughout the entire experience in terms of understanding how did family and support systems, how did they facilitate, or how might they have been a barrier to any of these? Work or student life, same thing. What was the impact of that? Housing, transportation, healthcare, insurance, mental health, and other health conditions, as well as finances and other costs. So, these are things that we think are very important. And through our pilot testing, we found that individuals generally really liked using this as part of the interview. And we've heard of some alternative uses for it as well. For example, as part of a prompt that might be helpful for a support group, or also just to manage expectations about, you know, it's not always going to be this highway that's very efficient to finding a treatment and achieving desired outcomes. So I am, of course, always happy to answer any questions that you might have about the toolbox. Let us know if you are interested in working with it, if you're interested in applying it for a specific study within a specific population, or if you have another idea about how you might use it. We'd love to hear about it and would love to chat with you about it. So again, my name is Elisabeth Oehrlein. My email is eoehrlein, EOEHRLEIN @nhcouncil.org. Feel free to reach out if you've got any questions. And we're really excited to hear about how everybody is using the tool going forward. So thank you again, and take care.